Hello, cruel world. Today I'm going to answer a simple question, but something that has a very complicated answer, and that is what causes depression? My name is Dr. Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. Well, basically, we psychiatrists, we categorize them into biological factors, psychological factors, and social factors. So in terms of the biological factors, there tends to be a strong component of familial history. So depression tends to run in families, as does things like bipolar affective disorder. So that's why, I don't know if you've ever been assessed by a psychiatrist, but they'll often ask you about your parents' mental health as well. Another huge biological factor is hormonal changes. So major hormonal changes that occur during, say, puberty, during pregnancy, during the menopause can cause depression in some people. I'm sure you've all heard of the concept postnatal depression, for example. Another probably rarer biological cause in terms of the cases that I see is chronic medical conditions. So things like heart disease, cancer, anything that is related to chronic pain can cause depression for obvious reasons. Okay, moving on to the psychological factors. One of the huge main core psychological features is negative thoughts and beliefs. So people with depression often have negative thoughts about themselves, about the world around them, and about their future. So pessimism for the future. And that all kind of contributes to feelings of hopelessness and helplessness, and that kind of contributes to the cycle continuing. Another huge factor, and something that I see commonly, is early life experiences. So people that have negative or harsh or traumatic early life experiences such as abuse, neglect, specific traumas, that all increases your future chance of developing depression. And another one that I will see is stressful life events. So the death of a loved one, divorce, losing your job. This is very common to trigger depression in people, especially if they're predisposed, as in they have a family history or they've had traumatic experiences earlier. And then finally, the social factors. So the biggest social factor that I see is loneliness and isolation. So that increases the risk of depression, and kind of connected to that is a lack of social support. So that makes it difficult to cope with stress and challenges, which not only increases the risk of getting depression in the first place, but once somebody has depression, if they don't have social support, if they don't have somebody to rely on, somebody that they can use as a kind of sounding board to cathartically explain their problems, that keeps them in the cycle. So it continues the cycle of depression. And finally, social stigma. So the stigma, this doesn't really necessarily cause depression, but it's one of the maintaining factors why people don't present for help, for therapy, see their doctors, antidepressants, etc. And that is because of the stigma of mental illness. They're embarrassed sometimes, they're ashamed to admit that there's something wrong. My final thoughts on this topic is it's important to note that depression is very rarely caused by one single factor. I mean, it can be in some cases, like grief, say, of the loss of a death one, but it's usually a combination of all of these things. So it's biological, psychological, and social, all kind of mixed together. Hope that all made sense. If you're interested in this kind of topic, my YouTube channel at Psych for Sore Minds covers both pure mental illness like this, related to offending, because I professionally assess defendants for their court cases who have mental illnesses, and everything to do with all of those topics. Go chickadee, check it out. Until then, have a blessed day.